Contraceptive injection can be injected into the muscle or sometimes subcutaneously. So subcute means it's injected right under your skin. What's up, beautiful people? Welcome to another exciting episode of New Mom with Dr. Who you already know. And today, I'm sure you've already guessed what we're discussing because obviously you saw the title. But anyway, I'm going to pretend like you didn't see it. Today, we're going to be discussing a very, very interesting topic. You know, as a new mom, like I said last week, you're concerned about contraception. You're concerned about not getting pregnant because that's the last thing you want. Like you just went through pregnancy. Finally, baby's out. You can lie down on your tummy. You just went through labor, and trust me, labor pains are still fresh in your head. So no, you're not thinking of having another baby right now. And that's why I'm here for you, because I'm going to show you the way. So last week we talked about oral contraceptive pills. This week we're talking about another form of contraception, which is contraceptive injection. So yeah, I have other videos where I talked about the copper IUCD. Last week we discussed the oral contraceptive pills, and I have where I've talked about short-term contraceptions like using female condom, using the cervical cap, different types of short-term contraception like the spermicides, for example the vaginal contraceptive film and all that. So I have them all over my page, so just look through the playlist, see, feed your eyes, have fun, enjoy yourself, right? And if you're listening to this on podcast, same thing is all over my podcast. So you just have fun, binge on it, okay? I do these videos just for you. So I hope you enjoy watching them as much as I enjoy creating them just for you. Okay, so I digressed. Back to what I was saying. Contraceptive injection. So basically, for some people that don't like the idea of taking pills every day like me, don't like the idea of taking drugs, right? You might want to go for the contraceptive injection, right? Or for some people that for whatever reason they feel like IUCD doesn't work for me, that's okay. There's contraceptive injection available, right? And how does this thing work? Well, let me just burst your bubble here. If you do not like needles, if you are one of those people that when they want to give you injection, you'll be shaking, running around the place, you need 10 people to hold you down, take injection, then maybe this method of contraception is not for you. However, if you are like the rest of us normal human beings that sit down and chest injection like it's nothing, yeah, right, I kid you. Yeah, right, I'm just joking. I'm a doctor, but I hate taking injections. I hate having my blood drawn or anything. I just hate needles, yeah, but yeah, I still chest it like it's nothing. Anyway, so if you're one of those people that don't like needles, then this is not for you. But if you don't mind needles, then it's okay, because you only have to do this every 3 months. So the contraceptive injection, what it does is it prevents pregnancy. How does it prevent pregnancy? Similar to the contraceptive pills, it will prevent ovulation and it will thicken the cervical mucus. And if you are a regular viewer of my shows, you know that ovulation is when an egg is released from the ovary. And for you to be able to get pregnant, you need an egg to be released from the ovary, and you need sperm from your partner to meet each other, and it will be fertilized to become the embryo, which is eventually going to become your baby. Okay, so if any of these stages of pregnancy is interrupted, then obviously pregnancy won't happen. Contraceptive injections interrupt pregnancy at the ovulation stage. That's one. It also interrupts the sperm from getting to the egg if at all it escapes ovulation stage. You know those stubborn eggs that just escape and they don't want to hear what. So it will now thicken the cervical mucus, right? So that sperm cannot easily swim through and come and meet the egg. So those are the two methods by which it prevents pregnancy. And contraceptive injections, they contain a hormone called progestin, right? So that's the mechanism, that's the thing behind the action of the contraceptive injection, okay? And you have to take it every 3 months. So it's better than the pill that you have to take every single day. Like, at least this one you have a 3-month break, so you only have to set 3 months reminder to remember to go to your doctor to take it. And unlike the pill that you can take by yourself, this one you need your doctor to take, because you can't inject yourself, can you? Even if you can, no one is going to let you do that. So you need to go to the hospital to get this method of contraception. So like I said before, contraceptive injection can be injected into the muscle or sometimes subcutaneously. So subcute means it's injected right under your skin. So for those that don't really like needles, it's a smaller needle, it's just under your skin. The pain is not as much when compared to the muscular one, right? So you can choose, right? And now let's talk about the benefits, right? The advantages of taking this thing. First of all, you have reduced menstrual cramps. So those people that normally have painful periods, yeah, this can help to reduce the cramping during your periods. Then another advantage is that your flow is not as heavy. In fact, in some people the flow stops entirely, which for some it can be a good thing, right? Because what are you using the periods to do before anyway? So for some, that's a big advantage. And another thing is that it reduces your risk of endometrial cancer. So endometrium is the inner lining of your uterus, so the inner wall of your uterus. So it reduces the risk of that type of cancer, which for me is a big plus if you ask me. So if you're at risk of heart attack, breast cancer, stroke, then this contraceptive pill is not for you, right? It's not for you at all. So your doctor will probably advise against this. So basically the question is, contraceptive injection for everybody? The answer is no. If you're at risk of those things that I mentioned, breast cancer, heart attack, stroke, even osteoporosis, then this method of contraception is not for you, okay? But let me tell you one downside of this contraceptive injection that almost everybody I know that uses it, all my patients complain about this, is that when you stop taking it, when you decide that, okay, I want to have my baby now, you know, if you're taking the pill, once you stop taking the pill, you can get pregnant by the next cycle. If you are using the copper IUD, once you take it out, you can get pregnant by next cycle. But you see this contraceptive injection, after you stop using it, it takes a while for you to be able to start ovulating. So it takes a while for you to be able to conceive again. It can take up to 10 months before your ovulation will start again. So it means that your fertility will be delayed for at least 9 to 10 months. And that can be frustrating for people that really just want to have a baby on time, right? You have planned and all that. So that's something to consider. If you are looking to have a baby anytime before the next 10 months, then you might want to look for another method of contraception. If you enjoyed watching this video so far, don't forget to click the like button, subscribe, and share with anyone you think might need to see this. Remember, being a new mom can be pretty overwhelming, but trust me, your kids are totally worth it. See you next week.